All right, hello and welcome everyone. We're going to go ahead and get started with today's video stream. My name is Nick Zupan. I'm the Rock County Public Health Department epidemiologist. So thank you for joining today for today's content. We're going to be talking about the Omicron variant today and some things you can do to protect yourself over the holidays here coming up. If you do have questions, feel free to put those in the chat box and we will try to answer any questions that come up at the end of the stream today. And if you have questions as you're watching the recording of this, feel free to send those our way and we'll try to answer them directly or we'll answer them on a future video. So without further ado, let's get into today's content. So the information that I'm going to be sharing with you is about the preliminary data that has come from South Africa related to the Omicron variant. So there was a study among a pretty large healthcare organization, an insurance provider in South Africa that was looking at the number of cases of COVID-19 and how many people tested positive in their kind of group of people that they provide insurance for. And the idea being to better understand how the Omicron variant is spreading, whether it's causing more severe illness, and some of the other factors related to how the virus spreads now that it's this new variant. So one of the things that I wanted to highlight, I don't have great visualization for this information, so I'm just going to be going through, this is a one-page kind of brief report that was published in the British Medical Journal. So this is available online to anyone, but basically it's a good source of information as we're trying to sift through all of the data and information about the Omicron variant and how better to understand how it might affect us here in the US and specifically in Rock County. So the first piece of data that I want to share from this report and the findings from the data analysis is that 90% of the sequenced cases in South Africa were the Omicron variant. So that means that it's spreading very rapidly. So in about a month's time or even less, we're seeing pretty rapid spread of this variant and it really taking over in terms of displacing the Delta variant as the predominant strain, the variant strain of COVID-19 that's circulating in South Africa. So what that means is that it is very likely as the Omicron variant spreads to other parts of the world, it will kind of outcompete the Delta variant and is much more likely to kind of become the predominant strain as we're looking at spread moving forward. And unfortunately, the Omicron variant has been identified in many different places, including Wisconsin and most recently Dane County. As of today, the 17th of December, it has not yet been identified in Rock County, but it is possible that it could be in Rock County because we do not sequence all of the positive results. So about 1 to 2% of the positive tests are actually, they go through the genetic sequencing process to identify what variant strain they might be. Right now, we're still probably seeing a lot of spread related to the Delta variant, but it's more than likely because of how quickly the Omicron variant spreads. It could quickly kind of take over in terms of outcompeting the Delta variant and causing further spread of the disease. So additional data that this article provides is related to vaccine protection against the Omicron variant. So what they found was that of those who had received two doses of the Pfizer vaccine, this offered about 33% protection from contracting the Omicron variant. So this is a little bit lower than the protection that was found related to the Delta variant spread. And so that means that we would expect more breakthrough cases for those who have only received 2 doses of the vaccine so far. I think that's one of the reasons that it's very important to get the booster doses at this point. We've seen data, even in Rock County, that after about 6 months, people's level of protection, their immunity from contracting the illness is diminished after about 6 months. And so that's kind of why we saw that information come from the CDC about getting a booster shot after 6 months of following the completion of the original 2-dose vaccine series. And if you've had the Johnson & Johnson vaccine, you can get a booster dose 2 months after receiving your last dose of the Johnson & Johnson vaccine. In terms of the data related to severe illness, the vaccine protection still kind of holds up. So we're seeing a 70% protection rate against severe cases. So it's slightly lower than the 93% that they observed with respect to the Delta variant when that was circulating. But still, lots and lots of people have protection against severe illness who are fully vaccinated, and that would be even higher for those who receive their booster dose. So it's looking like the Omicron variant is able to evade some of the protection imparted by the vaccine, but with people who are getting the booster dose, that is that is improved in terms of their level of protection, especially against severe illness. So the other piece of information that they looked at is related to this next paragraph, and this is with regard to natural immunity. So in terms of people who had had COVID in the past and then were potentially reinfected with the Omicron variant, they're finding that the natural immunity, when they compare it to the Delta variant, is less protective. So if you've had COVID in the past and Omicron is circulating, you are more likely to contract Omicron than the Delta variant. So what this means is that even if you've had COVID in the past, the chances of you getting infected again with the Omicron variant are higher. There has been research, and I don't think this is covered in this article specifically, but there's research to show that someone who has contracted COVID-19 and gets the vaccine is actually even more protected against contracting the Delta variant and the Omicron variant. So if you have had COVID in the past, it's important to get vaccinated because your natural immunity provides kind of little protection against some of these variant strains that haven't been circulating yet, like the Omicron variant in this case. So all this information is very important, and I think one of the key pieces of information that maybe many of you have seen already is the level of severity for people who have contracted the Omicron variant of the disease. It looks like there's a slightly lower risk of hospitalization for those who contract the Omicron variant compared to the Delta variant. So there is a 29% lower risk compared to earlier waves in the pandemic with respect to COVID-19 variant strains. They did find, however, that among children, the rate of hospitalization was up 20% with the Omicron variant. So these are potentially more mild cases, but still children were needed to be hospitalized more likely than the earlier strains of COVID-19. So something to be aware of and keep in mind. The other thing is that Omicron has been found to be very, very infective. And although for most people it may not produce as severe symptoms as the Delta variant, it just means that there will be more and more cases and more people may need hospitalization based on just the sheer magnitude of the number of cases that we may expect in the future. So it's really important, again, to seek out that vaccine as you're kind of thinking about how best to protect yourself and your family from the spread of the Omicron variant. We're very strongly promoting the vaccine among people who haven't gotten vaccinated yet, and especially getting booster doses. If you have received that vaccine, it's really important to get a booster dose to have kind of the utmost level of protection from the vaccine. So I wanted to talk about just some case spread and what some countries are seeing and what we may expect given the spread of the Omicron variant and it being identified in Wisconsin and in Dane County. I think we can expect some elevated levels of case activity. And I know we're in a period right now of pretty high case activity as it is. And we could see even more case activity as we're kind of getting into this phase of the Omicron variant spreading throughout the US. So one piece of information that I did want to share on the stream today was just related to the spread of the virus in the UK. So this website that I pulled up is through Johns Hopkins University, and they provided this information in terms of the global spread of COVID-19 throughout the entire pandemic. And we actually use this information to populate some of our reports with respect to kind of the worldwide cases and the US cases. But basically what I wanted to call your attention to today was just kind of the spread that is happening in the UK. So what I pulled up is the graph of some of the weekly incidents deaths and doses of the vaccine administered. What I'm really going to focus on is this top graph here in the red. And these are the number of weekly cases over the course of the pandemic. And what we've seen, this is in the UK, but I just want to present this as kind of what we could see in the US in terms of the spread of the virus. So in kind of the late fall, early winter months in the UK, they saw a spike. And then they saw kind of a dying down of the COVID activity throughout the spring and summer months. And then there is the Delta variant that was circulating widely kind of in the late summer and early fall. And more recently, they're starting to see the circulation of the Omicron variant there. So more widespread Omicron variant in the UK at this point. And they're seeing levels of case activity that are very close to the previous peak. And so they're seeing high spread of the disease, and even among people who have had previous COVID infection. And so that is potentially some trends that we could see here in the US and locally in Rock County. So just wanted to provide a little bit of data context. And like I said, although we're in a period of ongoing case activity, we could continue to see case activity increase. My hope is that there will be a reduction in the number of severe COVID cases. Right now, we have kind of close to 55 patients in the hospital getting care for COVID-19. So we're definitely in a period of elevated COVID activity and elevated numbers of people who are severely ill. So again, one of the things that I mentioned that we can do to protect ourselves and our families from the spread of the Omicron variant and severe illness, if the Omicron variant does take hold, is to get vaccinated. So for those individuals who haven't gotten vaccinated yet, there's plenty of vaccine available in the community. You can contact your healthcare provider. You can also go to rockcountyshot.com and get some information about community vaccine clinics, eligibility, also the cost. It's free in almost every case. Some information about vaccine safety, and the information that I've shared on previous videos is related to where can I go. So you can click on that link. There's lots of information about getting help with an appointment at your healthcare provider. We also have ongoing community-based clinics, both in Janesville and Beloit. They accept walk-ins. You can make an appointment with these community-based clinics, and the vaccine is widely available in terms of vaccine for children and vaccine for adults. These locations also do offer the booster dose of the vaccine. So anyone who wants to get a booster dose or get vaccinated for the first time or needs their second shot in a 2-dose series can access these community clinics. So again, the website is rockcountyshot.com. And finally, just the last piece of information that I want to share on the stream today is related to safety around the holidays and reducing the spread of the virus as we're thinking about getting together with our families and extended families and things like that. So the first thing that you can do to protect yourself is to get vaccinated. So again, if you haven't gotten vaccinated at all, getting that first dose can provide some immunity from the virus. And those who have been vaccinated in the past, and it's been 2 months since your Johnson & Johnson vaccine or 6 months since your Pfizer or Moderna vaccine, you're eligible to get a booster shot. And so it's highly recommended that people get a booster shot at this point with the kind of impending risk of circulation of the Omicron variant. We want to make sure people are fully protected from that variant. It's also important to wear a mask. We're still seeing that in cases where people are wearing masks, there's less likelihood of spread, and those masks are still an important tool to prevent against the spread of the illness. And when you're getting together with people outside your household, those masks can be an important tool, an effective tool to reduce the spread in those groups. Also, it's important to remain 6 feet away from individuals and avoid crowded areas. We're seeing lots of spread when people are in close contact. And so as much as you can, maintaining that 6 feet of social distancing is still important and an important way that we can prevent the spread of illness. Also, washing hands frequently. This is just kind of basic hand hygiene, but that can prevent a lot of different types of illnesses, including COVID-19 and other seasonal illnesses that tend to circulate at this time of year. It's also important to stay home when you're sick and get tested if you have symptoms. So if you have symptoms, there are tests available that you can purchase at many different stores. Also, you can go to our website, co.rock.wi. .us/public health, and we have information on testing that's available in the community. If you do have symptoms, it's important to make sure you get tested just to make sure, have that peace of mind that you don't have COVID, or if you do test positive for the illness, to make sure that you're not getting together with folks and spreading that illness to your loved ones. So with that, I'm going to just check the chat box and see if we have any questions that have come through. Just taking a look here and see if anyone has any questions throughout the video. And again, if you have questions and you're watching the recording of this video, you can always put those in the comment section of the video, or you can reach out to us directly sorry, I'm just reading the comments here. I appreciate that from Michael Smith. Keep on keeping on. I appreciate the words of encouragement. It's been a long pandemic for everyone, and making sure that we're trying to keep people safe and protected as new variants come up. It's always a challenge. So looks like there are no other questions that have come through. So at this point, we're going to close out the video for today. But thanks everyone for joining the video, and I wish everyone a happy and safe holiday season. And we'll see you in 2022. Thanks, everyone.